now this is the fun part, how to treat dystonia. So I'm going to run through this really fast, and there were some suggestions for treatments of dystonia that you might go down depending on what kind of dystonia you have. So with Parkinson's specifically, if you have dystonia, then your doctor is going to do, obviously, a trial of L-DOPA to see if you have DOPA-responsive dystonia. So you take your Parkinson's medication and your dystonia improves, then you have DOPA-responsive dystonia. That's wonderful. But, there is another option if you have a focal dystonia, and maybe just in your hand or just in your neck, then Botox is typically the first choice for focal dystonia. Things like blepharospasm, which is just spasming of your eyes. Cervical dystonia, that's a good option for Botox. Upper and lower limb dystonia, so upper limb is your arms, lower limb is your legs. And laryngeal dystonia. So I've had a few patients who have issues with their kind of spasms in their voice box, and they get the Botox and it helps improve their speech. So know that you can also have dystonia in your vocal cords. Those are tiny little muscles in there. So Botox has been found to be pretty effective with the laryngeal dystonia. They did talk about how some surgical interventions like deep brain stimulation, DBS is typically the first choice for generalized dystonia. And there are some experimental studies and research going on about transcranial magnetic stimulation. I've never seen that in my practice, but that is in the experimental phases and may be a surgical option for dystonia in the upcoming months or years. One thing they did talk about is rehabilitation and physical therapy. Where does that come into play for dystonia? And unfortunately, we don't have a lot of research that's being presented about rehabilitation here at this Congress, but rehabilitation is an adjunct to all of these other methods. So if you have Botox, you should be also getting rehabilitation to help you re-strengthen, kind of re-educate your muscles on posture and biomechanics and all that good stuff. So rehabilitation kind of comes hand in hand with these other interventions, whether it's your medication, whether it's your deep brain stimulation or Botox. You need to be seeing a physical therapist so that they can help you use your newfound movement to the best of your abilities. Also, if you have something called camptocormia or Pisa syndrome, rehabilitation is definitely one of the first choices for those postural deficits. So it could be if you have really, really bad posture or you're leaning to one side, you may have something called camptocormia or Pisa syndrome. Talking to your movement disorder specialist about those things and going to see a physical therapist so they can help you strengthen and stretch and get you in better posture and better alignment and awareness of where you are in space. And then finally, the two other adjunct treatments they talked about were with eye spasms specifically. There's some research to suggest things like they call them clutch glasses or sunglasses or even a headband we've used with some of my clients. Pressure on your temples can potentially be a sensory trick is what they're calling it here. A sensory trick to help you overcome your eye spasms. That might be something worth trying. And then acupuncture for, things that they call it overflow. So when you have muscles that you go into dystonia and you feel like it starts in one part of your maybe hand and it overflows into your overflows from your fingers to your hand into your arms, they were suggesting that acupuncture might be a good supplement to help you kind of calm those muscles down, and then obviously pair it with some physical therapy so that you can re-educate those muscles on how to work correctly.